Say, okay, we will reduce our in-hospital costs and increase our...
Well, I think that's emblematic of what we're talking about. Not enough time to really understand what the ramifications are for all the states. I mean, the bill is changing even as we're about to vote on it later this week. So I think it's really unreasonable to expect all the various players to understand what we are signing up for. I think there's going to be a lot fewer people that are going to be covered for insurance, particularly Medicaid patients. And I think it's going to put substantial financial burden on providers, hospitals, et cetera, because there's going to be people who are going to come for care that there's going to be no payment for. And so I think this will put a real stress on our healthcare delivery system across the country and the people who are dependent upon it.
Replacement's going to cost you at 10 different places, and there's a company in California, in full disclosure.
The states would only have 2 years to set up the mechanism for distributing this money, and certainly having various 50 different distribution systems would certainly be inefficient and costly for the country as a whole.
Yeah, I don't think there's any question that we are way under.
I don't think this bill begins to deal with the issue of which the basic root cause of our problem, and that's the rising cost of health care.
But this is the difficult part about it, where you're going to have transparency around costs.
I think it's totally missing the point. The point is that the ACA did a good job in getting more people coverage. It did a good job in improving the quality. The problem with the ACA is it hasn't dealt with the rising cost of health care. And I think what we need to do is address the rising cost of health care, and that's going to take some hard work coming out of Washington, which is difficult.